Each person lost is a cruel reminder of the severity of this virus. We have now lost 16 people, and while we report them as numbers here, to families they are not just numbers, but people who leave behind loved ones and friends. Before I invite the Minister of Health to provide an update on the latest COVID-19 results, I think it is important to properly frame why we are where we are as a country. This current outbreak started because of reckless conduct, which introduced the variant and it spread into the community. That spread has increased and continues because of the mixing of households, contrary to the public health advice. We are now seeing cases beyond the initial events that arise from Good Friday events, which again mix households despite strong government advice not to do so. The number of people in hospital, the number of people in ICU, and the number of people testing positive for this virus means that we must take stronger action now to stop the spread and save people's lives. We must and we will act now. As indicated, I am joined tonight by the Minister of Health, the Honorable Kim Wilson, who will provide us an update on the latest COVID-19 test results. The Chief Medical Officer, Dr. Ayo Oyinloye, is also present to answer any medical or technical questions from the media. And we're also joined tonight by Dr. Wesley Mitter, the hospital Chief of Staff. First, we'll hear from the Minister of Health. Minister?
Thank you. Good evening, everyone. And I too would like to start by echoing the sentiments expressed by the Premier and offering my condolences and my prayers for support for the families who have recently been impacted by death of their loved ones due to COVID. As the Premier noted in last night's press conference, our goal is to shorten the COVID-19 update press conferences. I will provide information on the positive cases, the positivity rate, and details of those who are infected, such as travelers who tested positive and their flight details. My updates will continue to include how many people are in the local transmission category and how many people are under active investigation. If anyone is looking for additional details, such as the mean age of the positive cases, that information will continue to be updated on the government website at coronavirus.gov.bm. Since the last update 2 days ago, there were 3,348 test results received by the Ministry of Health, and 118 were positive for COVID-19. This gives a test positivity rate of 3.5%. For Saturday, there were 64 positive cases out of 1,575 results with a positivity rate of 4.1%. And for Sunday, we are reporting 54 positive cases out of 1,773 results with a 3.0 positivity rate. 5 of the new cases are classified as imported with the details as follows. 1 resident who arrived on American Airlines flight AA308 from Miami on the 31st of March, 2021, and tested positive on their day 8 test. 1 resident who arrived on Delta Airlines flight 584 from Atlanta on the 8th of April, 2021, and tested positive on their arrival test. 3 residents who arrived on American Airlines flight AA2044 from Charlotte on the 9th of April, 2021, and tested positive on their arrival test. 20 of the new cases are classified as local transmission with known contact as associated with known cases. The additional 93 new cases are classified as under investigation, and these cases are among residents with no currently identified links to either known cases or history of travel in the past 14 days. There were 110 recoveries and 2 deaths, which we have previously reported yesterday. Bermuda has 1,891 total confirmed positive cases, and their status is as follows. There are 877 active cases, of which 844 are under public health monitoring, and 36 in hospital, with 6 in intensive care. A total of 998 have recovered, and the total deceased is 16. The 7-day average of our real-time reproduction number is above 1, namely 1.07. And I will provide the vaccination statistics at Tuesday's press conference. Our mission in the Ministry of Health remains focused on providing accurate, timely information to the public about all measures in place that will help to stop the spread of the coronavirus. We continue to see a high number of positive cases and now deaths. This is avoidable. As the Minister of Health, it is extremely frustrating to know that Bermuda is in a state of community transmission because some people chose to ignore public health measures such as mask wearing or hold or attend parties with large groups of people in contravention of the law. We must work together to stop the spread of coronavirus. I'm hearing stories of people who are unwell, leaving their homes to run errands or visit with friends. Others who go to work with a cough. When these people get tested, they are found to be positive and in turn have already infected the people that they have come in contact with. I urge everyone, if you have a headache, stay at home. If you have a muscle ache, stay at home. If you have a cough or a runny nose, please stay at home. The symptoms of the UK variant, the variant which is prevalent throughout Bermuda, seem different from the symptoms that we identified for the earlier strain of the coronavirus. Symptoms of the UK variant tend to include cough, tiredness, headache, muscle aches, and sore throats, which are easily confused with seasonal allergies. If you experience any of these symptoms, please contact your doctor and make an appointment to get tested. Likewise, if you have been in contact with someone who has these symptoms, make an appointment to get tested. The UK variant of this virus is also exceptionally contagious, and the symptoms of this disease are deceptive. This means we must all pay very close attention to even the slightest change in our health status. For example, yesterday you were not coughing, but today you are. In those situations, go and get tested. Once you've been tested, you can expect to receive the results within 48 hours. Often results are sent in much less time. However, if you have not received your results, do not call the COVID-19 helpline or the molecular diagnostic lab. Your first call should be to your doctor's office, who will give you the results and provide you with guidance on what you should do. The lab is processing hundreds of tests a day, so the key point is to be patient. Given the enormous number of positive cases at this time, there are delays with respect to contact tracing. We are grateful for local doctors for assisting with the early notification of a positive result for their patients and informing them of the need to start making a note of their close contacts. A reminder though, if you are told you are a close contact, please quarantine immediately. Do not wait for you to be tested, but you must immediately but the most immediate helpful advice that you must do and the necessary thing that you must do upon receiving information from someone that they are positive and you're a close contact, you must immediately quarantine. Each of us has a role to play in stopping the spread of coronavirus. Follow public health guidelines, wear a mask, practice good hand hygiene, maintain physical distancing, download the We Health Bermuda app. And if you haven't already done so, register to get vaccinated. Thank you.
Thank you very much, Minister of Health. Earlier today, the Cabinet met to discuss our current circumstances and the Ministry of Health's recommendations for further actions to stop the spread of the coronavirus. The recommendations are founded in a need to stop the spread, permit the vital work of contact tracing to accelerate to isolate positive cases, and allow our healthcare teams to focus on increasing testing and vaccinations. Accordingly, the Cabinet has agreed the following: that Bermuda will be under a stay-at-home order from 5 a.m. on Tuesday, April 13th, for 7 days. This means that persons are not to leave their homes for anything other than essential movement or grocery shopping. Grocery shopping will return to alphabetized days with shopping by surname. Shopping for essentials at a pharmacy, also attending the gas station, attending a vaccination or testing appointment, or attending a medical appointment at a registered healthcare professional's office. Additionally, there will be limited banking services that will be able to provide it. These permitted businesses will operate from 11 a.m. to 7 p.m. during the 7-day period of the stay-at-home order. These are the only businesses that will be able to remain open. All other businesses which cannot operate remotely must close. Grocery stores will remain open and the supply chain for goods isn't interrupted. This means there is no need for people to rush to the shops to panic buy. Buy what you would need normally and continue to be considerate of others. There is enough for everyone. Again, working from home is mandatory. And if you cannot work from home, you must remain at home. Household mixing is prohibited and will be specified like that inside of law. If you choose to mix households or visit another household, you will be violating the law that will come into place at 5 a.m. on Thursday. And as can be seen, you could be endangering your health and the health of your loved ones. The cabinet will continue to deliberate, and on Tuesday, when our next press conference is held, we will lay out further details regarding the stay-at-home order and what our next steps are, including changes to the restrictions at the country's borders. It is clear that the rate of spread is far more advanced than we believe, and the regulations put in place have not been enough to slow it down. We must act now, as continued unabated household mixing is leading to increased transmissions and persons are becoming ill due to the severity of this variant. With these enhanced measures, our goal is to slow the spread, ramp up testing, and continued expansion of our vaccination program. Vaccinations are essential to getting our island back for how we wish for it to be, and expanding our vaccination program will be done with the specific intention of reaching herd immunity by the end of May. Vaccinations work, they prevent severe illness, and therefore prevent hospitalizations. As I close, this outbreak is far-reaching, and it has affected many. You're used to seeing me at these press conferences from the Cabinet Office, but there is a reason why I'm joining remotely today, and that is because I recently tested positive for a coronavirus infection. It was a very low-level positive due to the fact that my immune system can recognize the virus due to the vaccine, and I've had no symptoms whatsoever. It was my 5th test in 3 weeks, and on Good Friday, my entire family tested negative. So it was quite a shock, especially as we've been extra cautious. But it is a shock that has been experienced by many in Bermuda. Thankfully, they have all tested negative again, and they are quarantining while I'm isolating from them as required by law. I am fine, and thankfully, because I've been immunized, I have no fear, and I've experienced no symptoms. But it is a reminder to all of us that we cannot be too careful, and we should avail ourselves of the testing that is available and make sure that we protect ourselves due to the vaccine that is available. This virus is not a hoax. It is real. It has impacted the world. It has impacted our island. It has impacted families. It has impacted our national psyche. However, there is one thing that it has not impacted, and that is this government's determination to see this country through. Unlike other countries in the world, Bermuda has enough vaccine doses to get this country to herd immunity. And we will use this time to accelerate our vaccination program to ensure that we salvage our peak tourism season and have a regular summer. Just like we set a goal to administer 38,000 vaccine doses by the end of March, and we met that goal, I have no doubt that we will meet the goal of herd immunity by the end of May. However, we must be vigilant. We must follow the rules. We must recognize that our actions today will be the cause of our future tomorrow. We must all stay at home and protect ourselves and our families and to protect our country. To ensure that our hospital is able to service all those who need help and our brave healthcare workers on the front line can get some relief. Over the coming days, we will be in our separate homes. Despite this physical disconnection, we must come together with a collective mindset to do what it takes to end this outbreak in this country. I know that it will not be easy, and I know that many are frustrated, worried, and ultimately tired of this persistent battle. This does not mean that we have to agree on everything, but it does mean that we must work together to achieve our common goal of stopping the spread of the coronavirus and ensuring that we protect our entire healthcare system. As I had indicated, we will be giving another press conference on Tuesday, where we will lay out the next steps, which will take place after the initial 7-day stay at home order. But the most important thing for all of us to remember is do not mix households, be very careful and be very vigilant, and follow public health advice. Give your contact tracers information, make sure you quarantine if you're asked to do so, isolate if you're required to do so, and make sure that you do what is necessary to help this country get back to where it needs to be. With that, I'm happy to take questions from members of the media.
Premier, we'll start with Mackenzie Cole-Tuckett for Media Maya. Mackenzie, you are live. Please ask your questions.
Good evening, everyone. If you can hear me correctly.
We can hear you.
All right. Mackenzie Cole-Tuckett reporting for Media Maya. I will just. My first question is for Dr. Miller. Earlier this week, the BHB asked families to take home their loved ones who were fit for discharge. Are you able to share how that's going?
So far, I must say we thank the public for their response. The response has been good. There were a few people who initially were reluctant because some wanted to go on holidays and they would do it when they come back. There were some who also were reluctant because they had relatives who had tested COVID positive, came in because of that, but they were now well enough to go home. But after giving them the appropriate reassurance and also coupled with the guidelines from the Department of Health, they were willing and they took them home. So far that bit is going well, and we must thank the public because that placed us in a position where we were able to admit other patients.
Okay, thank you. And as a supplementary, how is the BHB managing with the significant increase in COVID-19 related admissions?
We are coping because we did make extensive preparations. So in terms of ICU, we created a satellite ICU so that we had more than enough ICU beds. We also have enough ventilators. In fact, we have 30, so well over and above what we expect to use. Our challenge really is in terms of staffing, because as you know, in a pandemic like this, some of our staff get ill and they have to go off. Also, unfortunately, some of them did not take the vaccine, and it therefore meant that those who didn't take the vaccine, we can't bring them back quickly if they test positive. So they will be off for a minimum of 14 days. So that placed some pressure on us and the remaining staff.
Okay, thank you. My second question is for Mr. Premier or Minister Wilson. In light of our current COVID rates, does the government have a position on persons who must work second jobs and are therefore in more than one workplace bubble, specifically those who are unable to work from home?
Okay, Mackenzie, yes. And no doubt the Premier can speak a little bit more to that insofar as the relief that's going to be afforded to individuals that find themselves impacted by their employment status being adversely impacted by COVID. Clearly, it's a concern because we recognize that in addition to there being challenges with respect to COVID, but also from a public health perspective, poverty or inability to feed one's family, or the stress related to not being able to work also has a adverse impact on one person, on an individual's on their psyche, on their mental and their physical status. But as the Premier has indicated, there will be relief that's offered similar to that was offered previously for individuals who find themselves unemployed or their employment status impacted adversely because of the closures of various establishments due to the restrictions that the Premier's just announced because of COVID.
And thank you, Minister. As I had indicated in my comments, Mackenzie, on Tuesday, we'll have another press conference where we'll do details. However, individuals who are affected by mandatory business closures can go to uba.gov.bm and can go ahead and to apply. The intention is for the initial stay-at-home order to last for 7 days. So it goes into place this Tuesday. I misspoke earlier and I said Thursday and Tuesday, so some may have gotten confused. Tuesday at 5 a.m. And that will be in place until next week, Tuesday at 5 a.m. We will be giving a press conference on Tuesday, and there may be another press conference to also give further updates later in the week. What is most important right now is that we act very quickly to make sure at this point in time that we do not put additional pressure on Dr. Miller at the hospital and his staff. They do have the capacity to cope, but there is a certain point when we certainly don't want to have 30 persons in the country on a ventilator at one point in time, though there's the capacity, we don't want to use it because there's other stressors, as Dr. Miller indicated, the staff. So though we have the technical capacity to certainly care for a large number of sick people, the staffing issues will certainly become a challenge. And certainly there's staffing issues with the epidemiologists, and there's also with the testing. So we need to make sure at this point in time that we're okay. I mean, these things fluctuate. So the one thing that I want to just say is that the help is there for businesses. There will be relief for businesses from the BEDC. We recognize this is difficult, and what we are going to do with the additional details that we'll be giving later this week is speaking about what after the 7 days will look like. Because the most important thing to do is to make sure that we protect our healthcare system, and that is to ensure that we protect the hospital so they can continue servicing not only persons who may become sick with the coronavirus disease, but also persons who may need help and acute care at the hospital for non-COVID related items.
Thank you. My next question, Mr. Premier. In light of the stay-at-home order and the recent COVID-19 exposure at the Royal Bermuda Regiment reported at the end of March, do you anticipate a significant impact on their ability and availability to assist with the enforcement of the COVID regulations over the course of the next 7 days?
What I would say is that I believe that the regulations and restrictions will be enforced by elements of the Royal Bermuda Regiment and the Bermuda Police Service to ensure compliance. And I'm certain that they will have the manpower that is required in order to enforce the regulations as necessary. I would encourage persons to not try to test the regulations. Take 7 days and stay at home with your families. We have a situation where this virus is very widespread, and we need to make sure that we can do the testing, ramp up our vaccination program, make sure to continue to do contact tracing so that we do not have a higher spread of the virus. We believe that some of the actions which we put in place for two weeks ago are beginning to show some effect. But as I said, it is a choice between waiting for another week where we could possibly have something more catastrophic happening or overreacting. In this case, I'll be better to overreact and to protect the hospital than to underreact, possibly be correct, because the risk of not acting to protect the hospital is too great.
Thank you. Minister Wilson, with the switch to remote learning, many students, particularly older students who are due to sit external exams and those who are graduating in the coming months, may be feeling extremely stressed with our current circumstances. Students are wondering, is the emotional well-being hotline extended to those who may not be able to connect with their school counselors?
Mackenzie, thank you for asking that question. That allows me to reinforce a very, very important message with respect to the availability of the emotional hotline. That is available for any person that feels the need to have that type of support, or just to speak to somebody about some of the stresses or the frustrations that they're feeling. So thank you for asking that question, because it allows us to reiterate the messaging behind that, that is available for any member of the public.
Thank you. And my final question, Minister Wilson, the current guidelines for the Pfizer vaccine state that it is to be used on persons aged 16 and older. Now that we are in phase 3, will the government have a vaccine campaign that specifically targets those aged 16 to 21?
Mackenzie, are you 16 yet? Okay, we can have a little sidebar conversation. We are addressing that through a number of mechanisms. We have somebody that's specifically a social media guru that's going to be assisting us with respect to that, because we recognize it is critically important to get the messaging out, and the messaging, particularly for your age group, is through social media. We are looking for individuals that would like to be champions that will take the vaccination and champion the cause for us, because we know, as a matter of fact, that the only way to get out of this pandemic is to vaccinate. And so we want to encourage everyone to register and vaccinate. The registration process was widened for 16-year-olds. So we are certainly seeing an uptick in individuals that wish to get vaccinated and immunized. So we are certainly going to continue promoting that. And you and I can have a little chat afterwards, please. Thanks,
Okay.
Mackenzie.
Thank you. No further questions for me.
Thank you, Mackenzie.
Premier, we'll now have Earl Baston from Island Stats. Earl Baston, you're live.
Good evening, everyone. Good evening. With this latest announcement made by the government, will we still have the airport open for people to come and go?
The airport is not being closed.
The airport is not being closed. Okay, fine. And also with this latest announcement, what happens with 14 days? We've been coached and processed for everything happening. Stay at home for 14 days if you test positive. Why now 7 days?
Minister, we'd like to take that.
Sure. Yes, Mr. Bazin, that 14 days is a very important number, because that's the general incubation period. However, with respect to what we're proposing now, the first 7 days, which would be the stay-at-home order, as the Premier indicated, we will be making further announcements for the next phase, which will also involve quite a number of restrictions, as well as a requirement that you are not allowed to mix households. So that will be announced, and there will be further weeks with respect to that. So in totality, there will be several weeks where persons are unable to mix households. But more of that we will be announcing later on this week.
Okay. Obviously, everyone in Bermuda is looking west to the CLGP. What is the latest with that, with this period? Will they be allowed to train on the water while we're at home?
What I'll say is, Earl, when the cabinet made its decision, the cabinet does not consider what the impact on CLGP may or may not be. We're acting in the interest of health. But as you know, CLGP is on the sporting calendar for both the preparation of the actual racing. We'll work with the organizers to ensure that any activity is carried out in full compliance with the regulation and without exception.
Okay, I'm not quite understanding that answer, because I asked, will they be allowed to train while we're on lockdown? Because they're currently out there training.
I would say that comes into place on Tuesday at 5 a.m. We have not gotten to those matters yet, Earl, and so CLGP is on the calendar, and we're going to work with the organizers to ensure that any activity is carried out in full compliance with the regulations without exception.
Okay. Well, we'll have more, I guess, Tuesday night.
That will, absolutely, I have no doubt.
Thank you. That's it for me.
That's all? You didn't want to tell me about West End's victory today?
They won? Oh, yeah, they did. Yes.
Thank you.
Congratulations.
Premier, we now have Bermuda Broadcasting, Don Burgess. He's just coming online. Don Burgess, you're live. Please ask your questions.
Good evening and thank you. Mr. Premier, you just announced that you had received the COVID vaccine and that now that you have COVID and you've more
When
than.
it goes, does not go so far as to have COVID, but go ahead.
Okay, well, you've tested positive. And how might you answer those people who think that this might shake their confidence in getting the vaccine since you've already had two and you're 2 weeks past?
I would say that it should not affect the confidence at all. The fact that I'm here, the fact that I have no symptoms, the fact while there are many persons that are in hospital or experiencing symptoms who have not had 2 doses of the vaccine and are fully immunized, is a testament to the vaccine's effectiveness. I mean, the vaccine, the initial ratings was it was 95% effective against mild to serious disease. The Dr. I'll quote better the statistics in regards to the vaccine's effectiveness when it came to death. But the fact is that I tested positive, a very low level positive infection. As I said, I felt nothing. It was a CT value or CP value, however they say, where most doctors do not believe that you can be infectious. But the fact is that we take the precautions. We're going to wait in Bermuda. And our goal as a country is to accelerate the vaccination program to get us to a place where we have herd immunity. So for myself, I would say that I am an example as the reason why you should make sure that you get vaccinated. So in the off chance that you do get a coronavirus infection, your immune system can recognize it, fight it off very quickly, and you can, do press conferences in a Sunday evening from isolation.
Okay, thank you. We just heard that there are 36 persons in the hospital with 6 in the ICU. The average hospitalized COVID patient doesn't arrive at the hospital until approximately 2 weeks after the onset of the infection. If we count backwards 2 weeks from Friday, the number of active cases was around 200 persons on March 26th. This gives us an average of 14% of the COVID patients ending up in the hospital. If we look at today's COVID numbers, which are at 877 active cases, and we take 14% of them, we get to a figure in excess of 120 patients potentially needing hospitalization in the next 2 weeks. You just mentioned that the hospital has enough beds and meds and staff to take care of the current patients. How many beds do you have should such a large surge materialize? Dr. Miller?
Well, that surge would not come all in one day. And so what happens is that some people will get better and others go out. So right now on the acute side, we have 90 beds, but we have the ability to create, and we have identified spaces and we have the beds to ramp that number up so we can effectively double that number. But we will not have all the people in at the same time. Our big challenge is not so much the numbers coming in, it's staffing.
Okay. Thank you. We're learning more and more about breakthrough cases, meaning people who've been fully vaccinated, including 2 weeks past their second shot, who are contracting the virus. CMO at the last press conference on Tuesday, you reported that Bermuda had 23 breakthrough cases as of March 29th. Can you update us on how many breakthrough cases we've had to date and what is their status?
Hi, Don. I don't have the most recent figures yet. As you appreciate, the numbers are coming in quite quickly, so I can get that to you at some stage. But as of last week, we had 30 cases that I was aware of,
Including
and what their status was?
Sorry?
And their status?
What do you mean? The clinical status?
Hospital or ICU, or they just had home?
Oh, right. No. There's nobody who's been fully immunized. There's 2 doses plus 2 weeks who was admitted in hospital.
Mr. Premier, were you going to add to that?
I was just going to say, when he's counting the people, I would be one. But I think it's important to note that there is the infection and then there is the disease, which is caused by the infection.
Yeah.
Okay. Thank you.
It's a very important distinction.
The CDC came out last week and said vaccinated people in the United States can now meet indoors and unmasked with other vaccinated people as the risk of transmission is very low. We've heard talk about incentives in Bermuda. Why are vaccinated persons in Bermuda being made to lock down with the folks who have not been vaccinated?
Don, if I can answer that before the CMO gives the technical answer. Certainly, it is a concern that a number of persons have raised, but where we're operating from is we're operating from the place of science. And the CMO has given his advice. There is going to certainly be discussions this upcoming week, because I certainly recognize the concern of those people who have done the right thing and who have followed the rules and are now, at a place where they need to remain home while they've done everything right for those persons who may not have done things correctly. And then we see the situation that is at the hospital. But it is a discussion that we will have, but we're going to make sure that we make the decisions of which we have balancing all the available factors and all the available facts. CMO, don't know if you want to add a technical matter to it.
Well, thanks, John. So the best way to answer that question is that for fully vaccinated people, for fully vaccinated people, the reason why you need to quarantine is not primarily for yourself, is to protect people, more vulnerable people who are not yet vaccinated. And there's a lot of that on Ireland, and the testimony, the example of that is the number of people who are going into hospital that Dr. Miller talked about earlier on. We are conversant with the advice from CDC. We have looked at the backing data to that and compare that with what other jurisdictions are doing. It's noteworthy that it's only the CDC that's given that advice at this point in time. We believe that we will be getting to that stage when we have a significant proportion of our population and we are as close as possible to herd immunity as a country. So those restrictions will be lifted at some stage. It's just at this point in time, we're appealing to all the altruistic nature of Bermudans that this is not just for them, this is for protecting the whole country.
Okay, thank you. Mr. Premier, the government has been promising that this past week, several people would be in court for COVID violations, and yet there's just one prosecution, which was for a curfew offense rather than a party. We now have 4 dead Bermudans in the last 7 days. Many of the public have lamented they are obeying the rules and are having to pay the penalty for rule breakers by being yoked to tighter rules. When are those who are hosting illegal parties going to appear in court?
Don, I share the frustration. I understand the frustration. The frustration is real. And it is a topic of conversation, which I will raise with Her Excellency, the Governor. As you would be aware, the Governor of Bermuda is not responsible for the police and not responsible for the Director of Public Prosecutions, and we are not responsible for that process. We have made our point very clear that we would like to see. We have made the laws. We can only make the laws in our, I would say, our overseas territory or colonial system. We do not enforce the laws. The enforcement is done via the bodies under Government House. And so I will welcome you to raise that question. But I do know in my conversation with the governor is that she is working to accelerate this process. And sincerely, I hope that that process will be accelerated. But that is I share the concern of many because we are here due to the actions of a few. And I understand the anger of people saying, why aren't people in prison? I understand the anger, why are people in court? I understand the anger, why aren't people being fined? It is difficult, I get it. And so I am in no way, shape or form trying to make excuses. I would like to see quicker actions. And if the government were responsible for this, there may be quicker actions. But with the system of which we have, requires the police to investigate and the Director of Public Prosecution to file matters. And so we will wait on that. And if you have any inquiries from Bermuda Broadcasting News, I would ask that you could certainly address them to Government House.
Okay, thank you. The CMO, given that Bermuda doesn't seem to have any monoclonal antibodies available for early treatment, what effective treatments are being recommended for people who have mild cases of COVID and are at home?
So yeah, it wouldn't be responsible for me to give generic medical advice over the TV. Your first point of call is your primary care physician, your GP. Speak to them first of all. That's the most important advice I can give. They understand your medical history. They understand what works for you. If you have been diagnosed as having a COVID infection or indeed COVID disease, then you should speak to your primary care physician, who is best placed to advise you on what therapies can or cannot work for you.
Okay, thank you all very much. Have a good evening.
Thank you. Thank you very much, Don. Our next reporter is from the World Gazette, and we're just waiting for her to log on. Sarah Lagan, please ask your question.
Good evening, everyone.
Good evening, Sarah.
Question for the Premier and Minister of Health. Given the severity of the COVID situation we find ourselves in now, are there any regrets that we've not put these kind of measures in place earlier?
What I can say is, Sarah, that hindsight is always 2020. What we do is we balance the risks, we balance what it is that we have, and we look at the available data. And so we acted, phase 3 restrictions were put in place before phase 3 restrictions were put in place at the last outbreak. We acted very quickly a week after to put in phase 2 restrictions. We actually believe that there's a chance that the phase 2 restrictions with the minimized mixing of workplaces, which we're seeing a significant number of infections that are from, in addition to schools and other items, we will see a reduction. But as I had explained earlier, when you have so many different variables, you prefer to overreact in this case than to underreact. We think that the actions have been appropriate. There's some persons who think that we should have acted sooner. There's some persons in this country that do not believe that we should act at all. We will never balance the thoughts and opinions of all. We will continue to press forward as the government and make the decisions that we feel are the best, that are based on the advice in which we receive and the decisions which we make. So though we do not want to be in this place, I think we should also recognize that it has a world-leading vaccination program that is going to be accelerated even further, that is going to take us to herd immunity by the end of May. That is, as Mr. Health has committed us to. That is the target that the government will be committed to, and we'll make sure that at that point in time, there will be sufficient restrictions at the border to make sure that this does not happen again.
Okay, thank you. We have heard that more respirators are coming to the island. Is this correct? And if so, could you let us know how many are coming and why there are more? To Ms. Wilson, I guess.
Actually, Sarah, I'm going to yield to the hospital. We've got the Chief of Staff, Dr. Miller, who would be able to answer that.
Thank you.
We do have enough at the moment. Anything coming in now in terms of ventilators would have been from back orders. What we do have coming in are not ventilators, but something that may be confused with it. They are really for high flow oxygen, because that is particularly effective in the treatment of a subset of COVID patients. And in so doing, we can avoid putting quite a number of them on ventilators.
Okay, thank you for that. Can you give an indication, Dr. Miller or Ms. Wilson, on how many emergency staff have tested positive and been sent home, ER staff?
that sort of detailed information would be confidential, so I wouldn't be able to release for a small department. What I can say is that overall for the hospital, a small number of staff have been sent off. Most of them have been by virtue of having contact rather than them being positive. So we have them off on quarantine. There are a few staff who are positive, but then again, one would not wish to identify the individuals because of privacy concerns and any information that may be prejudicial to the individuals.
Okay. Premier and perhaps Ms. Wilson, in the absence of the Minister of Education, but are there any considerations being given to delaying the school exams that are coming up, given the disruptions to the education of our students?
Thank you, Sarah. I wouldn't be able to answer that question at this time, but I'm happy for that question to be posed to the Minister of Education, and I'm certain that he will do your best to give the response. What I can say is that the government of Bermuda is assessing the situation where we currently lie. This next week will be a very important week. We will see where the data is. It will give us a full indication of the measures of which we put in place over 2 weeks ago. And then we will make a determination as the next steps. What the minister is committed to, and what we're all committed to, is getting our students back to the classroom as quickly as possible. We've ordered additional testing resources, and if we need to test and to do other things, then we're going to make sure that happens. But we are not going to give up on the school year, just like we're not going to give up on the tourism season. We're going to aggressively accelerate our vaccination program. There are lots of people who are waiting for the call up and the appointment for the vaccination program. The Minister of Health is going to be enlisting doctors and community physicians and all other persons inside of this effort, and we will make this effort work. I want to thank the Bermuda Hospitals Board for increasing the vaccination effort, and I want to thank the staff at the vaccination center who have gone above and beyond, and the persons who have been leading this effort, who have done an absolutely incredible job and are going to be doing even more to ensure that we reach the goal of herd immunity by the end of May.
Okay, thank you very much. We spoke before about the majority of the cases being the UK variant. Is that still the case? And are there any other variants that we can speak of in Bermuda?
Yep, I can answer that. Yes, it is still the B117 strain, the strain that was originally identified in the UK, that is predominantly the strain that we're coming up against each time we say positive person. There are a couple of people who we think might be a reactivation of an old disease, or they didn't really clear their old disease. So have a handful of wild type virus, but it's mainly the B117 strain of virus that we're seeing.
Okay. Premier or Ms. Wilson, could you please tell us the difference between the stay-at-home and shelter-in-place?
The stay-at-home order refers to persons being required to remain in their household, save for exceptional matters such as going for medical treatment, going to get your vaccination, going to get tested. And you'll recall when we did the shelter-in-place a year ago, it also included the closure of the airports. And as the Premier indicated a few moments ago, that is not part of this particular next phase of the orders.
Thank you, Minister. That was the last question from the World Gazette. And now I'll bring in Trevor Lindsay from TNN, and he's just coming in. Trevor Lindsay, you are live. Please ask your question.
Good evening. Health Minister, I want to start with you. Why is it taking so long for contact tracers personnel to make contact with those positive persons? I've been told that individuals have, and I said it last week, and I'm still hearing the same thing, that it's been something like 10 days for contact tracers to make contact with positive cases. Why is this taking so long?
Thank you, Trevor. When you asked that question last week, I don't want to sound repetitive, but I will repeat what the CMO said. That does sound very unusual, that it would be 10 days for a positive person to have been contacted. I can't speak specifics, because obviously you haven't provided me with specifics. However, we have employed the services of medical physicians who are making contact with their patients in the first instance, patients that have been identified as positive, so they will get a call from their doctors in the first instance. We are increasing our contact tracing capacity with the additional services of individuals, as well as the Bermuda Red Cross are coming on board to assist in that. We are unfortunately in the state of community transmission. So for every particular positive case, there may very well be at least a household of close contacts. So if you take 800 times 4, you can imagine, you can do the numbers. Don's on the line, he can crunch the numbers because he's obviously a math person. But we are in a community, in a situation of community spread. So as the messaging has been previously, and as I said just a few moments ago during my remarks, if a person contacts you and says, by the way, I've been identified as positive, you're going to be one of my close contacts, we are asking those persons in the first instance to immediately quarantine until they receive further instructions from either their doctor and or the contact tracing team. Thank you.
Thank you. Premier, what constitutes, as you stated, low contact? Excuse my expression, but you can't tell a woman she's had pregnant, she's either pregnant or she's not pregnant. So what constitutes a low contact? You either have the virus or you don't.
Trevor, I contracted a coronavirus infection. It was a low level positive. I'll leave it up to the scientists to give all the definitions between CT values and what that means and how that factors into it. But the fact is that I contracted a coronavirus infection. I am in isolation and following the rules of which are necessary under the laws of the Quarantine Act as directed by the Chief Medical Officer of the country.
Okay, another question here. What happens to businesses with containers on the docks being shut down for 7 days? The first 7 days, I'll put it that way, and you're due to have meetings to either extend to see where we're going to go with this.
I would say that containers in the docks are essential services as defined under the Essential Services Act, and those containers will be able to be cleared off the docks. Whether or not they'll be able to be unloaded is a different question, but food supply, refrigerated containers, and those things will be able to continue as they were last year. What I would like to say, Trevor, is to provide a little bit of clarity. The government of Bermuda has prepared a number of various graphics which will be going out to remind people of the restrictions that are in place. I would ask people to do is just harken their minds back to a year ago when we were in a similar situation. And what that meant is that, you know, you're allowed to leave your house for an hour for exercise. You were restricted to your home, alphabetized grocery shopping, those type of things. This is a very serious situation. We are acting to protect the hospital. And that is what we must do, protect the hospital.
I haven't heard anything about those that are homeless, and I got a few calls about from family members of homeless individuals. What happens with the homeless in this situation?
Thank you, Trevor. It's a good question. As you can understand, there was a discussion that was held at Cabinet earlier on this specific issue. Last year, during shelter in place, we did provide services to the unsheltered population. But given the transmissibility of this virus, it would be unwise to put a person in a place, even if they are socially distanced as they last year, due to the challenges of which we are experiencing. The Minister of Social Development and Seniors will be speaking to precisely what services are going to be provided to the unsheltered population. But the one thing which we're going to make sure to do is to make sure that there is going to be testing that is going to be available to ensure that there are no outbreaks there as continued testing, because testing is already happening.
Thank you. My next question, as you all are really asked you this time, we were prepared for the situation we find ourselves in now with close to 900 or possibly more. My question for the Chief Medical Officer, what is the capacity for COVID cases in the hospital, and what is the capacity for ICU? What numbers can you give where you would consider you're at your breaking point at the hospital?
I will let the Chief of Staff of the hospital answer that question. He's here.
Thank you, Trevor, for your question. As I said beforehand, in terms of ventilators, we have 30. And we won't need ventilators for all the patients. As you know, very few go on ventilators now because we use high flow oxygen and we have other things. So in terms of ICU bed, we have created a satellite ICU. In fact, I've given instructions for that to be expanded, and that work is underway. And it's not an issue. Our real issue has to do with staffing, because as have a situation where quite a number of our staff have not been vaccinated. So when they go off sick, by virtue of not being vaccinated, I cannot bring them back early. So there's pressure on the remaining staff. And part of the problem with COVID is not just the numbers, but some patients stay a very long time. And it therefore means that you run the risk of burnout of these specialist nurses. In preparation for that, we have also cross-trained a number of nurses. So, you know, we have a complement of nurses in the operating theater and the post-anesthetic care unit. And they're all trained to carry out these functions, and they can do them very well. Our challenge really, though, would be having large numbers on a sustained basis, not because of capacity, but because of staffing issues.
Thank you. I don't know who can answer this question. Who is policing, who is monitoring those that are positive? Because I'm getting word that you get those, some that are supposed to be home quarantining are leaving after 4 days to run to the shop, as stated earlier. Who is policing the 800 and so those persons that are positive?
Well, Trevor, obviously individuals, we do have a civic responsibility, not in addition to the fact that it's unlawful for them to leave their premises whilst they are meant to be in isolation. And if those type of information comes to you, I suspect, and I would hope that you would do the responsible thing and call 211, as we are informing our persons to do. We still do have the regiment that are assisting to provide not enforcement, but that are actually helping us with respect to going to persons' houses and ensuring that people are being compliant with respect to the regulations as it relates to those persons that are positive. The regiment have played a really, really critical role in this matter, and we are actually quite thankful to have their assistance, in addition to them assisting at the testing centers as well as at the vaccination centers, but they also do assist us with respect to enforcement of the regulations as it relates to ensuring that persons are where they're supposed to be during the period of isolation.
Thank you. My last question, if it's okay. We've had a few incidents this weekend where individuals carrying on recklessly at a certain club, and we all know about it. What is going to be the consequences for those violators? Is there going to be extended consequences for these violators, these individuals that are not adhering to COVID regulations?
Trevor, I have no idea what you're talking about. I'm sorry.
There was a situation at the Dandy Town Club on Friday night.
Oh, okay.
Police put out a statement. What are going to happen to these individuals that are violating in these large groups of activities?
That was the statement the police put out. They didn't mention where it happened. And unfortunately, Trevor, I don't get the forwards that you get, so I certainly didn't see the video. I will say that the enforcement of the rules is something that the government recognizes important. And it is our sincere hope and desire that the authorities who are responsible for enforcement will hold persons to account for violation of rules which the elected parliament has blessed.
Thank you, Premier. There are no more questions. If you wish to give some closing remarks.
Absolutely. Thank you very much, Aderonka. I know that this news is not the news that many persons wanted to hear, even though many persons expected this to be the news that we'll be delivering this evening. But what is important is that we remember the importance of staying at home and not mixing families. It is vital that we do not mix families, do not mix households. We will get through this. We will accelerate our vaccination program, and we will return to normal very quickly. We must protect our hospital. This is why these actions are being taken. And I ask you to tune in on Tuesday night at 5:30, where we'll have more details on what will follow the 7 days stay at home order. So I wish everyone a very happy, good night, Bermuda.